I want you to stand up tall and proud. I want you to speak up clear and loud. Brown baby.
What's happening, y'all? I know it's been a while. Been kind of busy, as you can see. I just wanted to give a shout out to BGS. Been on his stream all week, talking about some of the things that have been going on with this COVID situation. The pandemic is hitting everybody pretty hard, the South especially. But with this one, I wanted to kind of talk about what's going on in Arkansas, just to give you guys a little bit of a view of it from where I am. So yesterday we had 2,940 new COVID cases. And hospitalizations were at their highest level for the third straight day. Okay, now it's the fourth straight day. You know, and Arkansas health officials confirmed early in the morning that there were only 8 beds for the entire state. For millions of people, there are only 8 beds, and that's you know, any kind of bed, you know, for COVID or regular patients. Then those numbers came up later in the day, and as you can see here, they were keeping up with it all day long. But the number of beds got up to 14 ICU beds that were available. Not sure about the rest of the beds, but those are the numbers right there in front of you. You know, and that's again for the entire state. You know, for quite a few people. Not sure what our total population is, but I'm sure it's millions here for the whole state. So that's pretty bad, you know. And you know, they're talking about the Delta variant being here and its effects on the population in general. Our governor, Asa Hutchinson, basically signed off on a mask ban because he felt like the numbers weren't high enough to support instituting a ban on the population for its safety. But like I said, I did a video about 4 months ago where I said that basically this was probably going to be a mistake, that the numbers in Arkansas and Texas, the surrounding states, were going to rise, and they did. People got laxed. People stopped wearing masks. just the general attitude just became troubling, to say the least. I mean, just walking around to the grocery stores and just anywhere out in public. I mean, people were just what we used to call in the military just free balling, man. They were just out here, no care in the world. And I think that a mistake that we've made is that we've tried to keep the public fear down, and I think that's been to our detriment. I think people need to fear this because, I mean, it's serious. We've heard all kinds of excuses about, well, these people are dying because they have comorbidities. If you're, not overweight, and if you don't have any kind of other ailments, heart disease, kidney disease, or, lung disease, things like that, then you'll be fine. Well, that's not the case. And it's never been the case. This thing has been indiscriminate in who it attacks. And it's just not a good situation. Even if you get over this illness, you may have lifelong ailments as a result of catching this virus. And, I just don't think that that's worth it. I don't think any sane person will look at that, at the odds in a realistic fashion, and come up with a solution that would indicate that I should not take precautions to protect myself and my family. And I'm particularly disturbed with the African American community and the clinging to conspiracy theories and old adages and stories passed down, just mythology about things that have happened. I mean, all you have to do is read. I've heard everything from, Tuskegee experiment and black folks being injected with syphilis, which never happened. All you have to do is just go read. All you have to do is, when you do a Google search, put in reputable source before whatever it is that you're looking for, and you'll get the information. And I would task, all of the naysayers out here to not search for information to the negative, to boost your belief that you shouldn't be immunized, but to seek out information for the sake of finding out the truth. I think that's one of the things that brought me to the Black Manosphere, and that is that one of its fundamental core principles is truth. We're supposed to stare truth in the face and deal with it. Not make excuses, not, come up with buts, and I've heard this a lot too. I mean, I just spent, like I said, 3 nights on BGS's panel talking about this situation. We set up, and each time someone brought up something crazy, I offered links with information for them to read. Not just a news story, but papers, scientific papers that broke down how the studies were done, how the information was gathered, and what their conclusion was, what their observations were. If you look at something and it's purple, it's purple. I mean, it's just not, you just can't make up a color and just say, hey, it's red. You can't do that. And with these papers, you have to realize that these are peer-reviewed studies. So that means that multiple scientists had to review the data and come to a consensus that is the correct findings, of whatever the study is. Shout out to Green Gorilla. Shout out to Dr. T. Hazan Johnson, Art Newstyle, Art of Ibmore, Charles Faulkner, and Kevin Samuels. Appreciate you, Kev, for everything you do. Keep up the good work. Congratulations on that 1 million, bro. But I'm going to move on to the next end of this, and I'm going to talk about these kids. Okay, you look at that graph there. Arkansas has 1,060 small children with active COVID-19 cases. And it shows the age distribution. And if you look at this, you pause it and you blow up that chart, it'll show you those cases, the numbers, age distribution. Okay. Those kids didn't have any comorbidities. They were just born. There's another story. And you look at that, they were talking about this Harrison father of one-year-old in the hospital, with COVID-19 in Missouri. And he shares his message. I mean, I read the story and then they took it down, but he talked about how painful it was to have to sit and watch his 1-year-old son struggle to breathe, and how he would struggle for a time, until he was completely exhausted, and his father could do nothing but sit there and cry. He couldn't help him, can't breathe for him. All you can do is hope for the best, hope that they have what they need to get through it. And because these kids are too young to be immunized, they don't have any choice. But the parents that were around them, they had a choice. You could have got your immunizations, protected yourself and your family, control who you are around, what you do, for the sake of the safety of those that you love. I don't understand why this thing has become politicized. I just don't understand it. Science is apolitical. But people in this country have used this to divide people and to put people in harm's way. And, I'm just at the point to where, I've gone through this since what you guys knew of was, 2020. But actually, I believe that we were seeing this in the end of 2019. You guys remember the vaping disease that everybody was talking about. They were trying to get down to the bottom of that vaping disease and why these kids were, dying from respiratory illnesses, Then we also started having, I know a friend of mine whose wife went on a cruise and came home, and she's in her, let's say her 40s, and she died of pneumonia. That's crazy. She wasn't sick, wasn't sick when she went, was only on the cruise for a little while before she got home. Well, by the time she got home, she ended up dying. Okay. It was weird, but she wasn't the only one. There were other people who were getting off these cruises and were sick. And then next thing you know, the year flipped over, and then all of a sudden it was, we're talking about COVID, and then we were swamped. But some of these things, all these things were kind of happening at the same time, all these weird respiratory situations. And even here, we're starting to have respiratory illnesses alongside the COVID-19, kids with RSV, you know, and COVID-19 situations. I mean, our beds are just, I mean, they're full. Our hospitals are full. As you can see, look at that nurse up there. You see what she's wearing? You know, do you think that you know, you can do that for, you know, years? Because that's what we've been doing for years. We've been doing this, you know, wearing face shields, mask. In her case, she's wearing doubled up mask for double protection. She's wearing a gown, you know, plus your scrubs underneath that, plus you're wearing gloves, doubled, you know, you got footies on, you know, booties. And I can tell you, it's hotter than hell itself in that. And you are trying to continue to be personable and to do your job and to take care of people in some of the worst situations that you can imagine. And you just move on from one room to the next room, taking that off, putting it back on. You know, it's stressful to say the least. But moving away from that, how stressful do you think it is for these people who come into contact with people who refuse to get vaccinated because they don't believe it works, because they think that there's radio chips or whatever the hell else they're coming up with in it? All of that's been refuted. Like I said, I spent 3 nights tearing that stuff down with scientific papers. And the stuff that we had to listen to was ridiculous. You know, you guys go over to BGS's site and you check out those 3 days, and you check out what we had to listen to and the, you know, some of the asinine arguments that were placed before us to have to deal with. That comorbidity stuff is, you know, it's not going to save you. I mean, your people out here telling themselves whatever they can to try to keep from doing the right thing. And there's going to come a point where people are just going to get tired. And then you got to ask yourself, once you get it, and then you're struggling and they're telling you that you're barely hanging on, you're going to do like everybody else. You're going to beg for them to give you that shot. And what they're going to tell you is, it's too late. It's too late. We can't give it to you now that you got it. It doesn't work that way. You know, and some of these people are just suffering from a fundamental lack of basic medical common sense. We've been using vaccines for over a century. You've always had to have a shot record to get on planes, to go to school, to go to nursing school, to go to medical school, whatever, college. You have to have those. I used to work in pediatrics too. You have to give those, you have to have those immunizations. I had to deal with anti-vaxxers there too. And I think that we've really just been a little bit too understanding with a lot of this nonsense. And that's why we're seeing things pop up that we've already eradicated. And I'm gonna go into that a little bit later too. Let's move on to the next slide. I've gotten a little heated. Okay, you know, the next aspect of this is that, you know, that people aren't really, you know, taking into consideration is that, like it says here in this slide, excuse me, this is a perfect storm. The rural hospitals that we used to have, because those hospitals have basically either shut down due to high medical maintenance costs of being a rural hospital, and been bought up by, bigger hospitals that basically just shut them down so that you will have to go to the big hospitals. But that's another whole nother issue. But that's the system used to be layered. You used to have big hospitals, and then you had little hospitals, and then you had nursing homes, and then you had clinics. Well, no, you had clinics. Yeah, you had nursing homes, and then you had clinics, okay? Now, you don't have that stratification in the system like we used to. So what you got is what you got in those big hospitals. So the number of beds have decreased over the years. But these rural hospitals, the ones that still are around, are facing a critical situation as COVID ICU beds fall to only one available in Arkansas. As you can see, we're constantly going, we're wobbling between small double digits to single digits. And those beds are either opening up because people are getting well or people are dying. So that you know. Now, to give you another perspective on this, and I'm going to show you another one when I do the next video that shows you on a national level, the rise and fall based on last year and what we're seeing this year. Now, here it is just in my state, okay? So there's the ventilator use in, what's that color? We'll just say it's blue, The other one is like what? Orange, okay? The orange is the ventilator use, which was, which is 294 right now, and 1,435 on hospital beds, people who are admitted, okay? And this source is the Arkansas Department of Health, okay? Now, if you look at August of 2020, we only had 500 people, a little over 500 people in the hospitals, admitted to the hospitals with COVID, okay? Then we peaked in, where was that, January, February, we got really high, okay? Now, you look at August 2021, we have surpassed where we were in January at the first of the year, the highest that we were ever before that. So what we are seeing on average is 2,000 to 3,000 new cases a day, okay? And, that ought to let you know that basically what we're dealing with, we're just at the front of this, okay? We have not reached the fall when we're going to have a lot of respiratory illnesses, a lot of flu and things of that nature. And I've said it, when flu season comes, flu kills people, okay? COVID kills people. Flu, if you ever had the flu, it takes you down through there, okay? Now imagine having the flu and COVID, because you can get them both at the same time. Now, as you can imagine, that's probably going to drop your chances down. And then if you factor in that, hey, there's only so many ventilators, there's only, so much equipment to administer oxygen to people who are struggling with oxygen. There's only so much, so many, staff, so many nurses, so many doctors. We can only work so much to cover all of this before we're overwhelmed. It's like zombies, okay? Imagine you're out there in the zombie apocalypse and you're shooting zombies, and you got plenty of bullets. You got your nice group of people, but then 10 zombies come, then 20, then 50, then 100, then 1,000, then 5,000, 10,000. How long you think you're gonna last? That's what we're up against. Some you can heal, some can stay at home, Well, let me get back to that and back to the rural part. Okay. Now, what we're looking at with the cases that we see every day, we see in 2,000, 3,000 cases. Those are the people who went to the hospital. Those are the people who went and got tested. Those are the people who were, did the right thing. But what about the folks who are at home that don't even know what they have, that they're saying, I don't have insurance, I'm just gonna get on through it. So there's another layer of that you're not seeing, that nobody's even talking about on TV or anything like that. You may have people out there that are just out there. You remember in New York when they were going and they were, going and checking on people, doing wellness checks, and people were dead in their apartments. People started leaving the city because they were so afraid of catching it and just being out there, unable to get to medical care. You guys need to think about these things. It's serious. It's deadly serious. And this isn't just Arkansas. This is the entire United States. Look at the numbers. Look at how they're rising. And then I want you to ask yourself a serious question. Why would anybody in a leadership position who should be acting proactively instead of retroactively try to keep you from wearing a simple protective device like a mask? Telling you to, hey, go get the shot. But they weren't even telling you to get the shot before. They were secretly going and getting the shot and not telling anybody, Meanwhile, some of them had stock in some of the, medical care that was focused on, COVID, like Rand Paul's, wife. You're out here, basically trash talking, the medicine and the science, but you invested in it. That doesn't make any sense, but I want you guys to use good common sense. Like my dad said, common sense ain't so common, but I want it to become more common. And I want you guys to really, really think hard about what's in your best interest. I want you to, turn away from the vibrations and the Hotepian, philosophies that might, make you think that you should be doing something other than what we've done for the last 100 or so years, and just do the right thing. It's not that hard. I appreciate everybody. I want all of us to be safe and to do what we need to do to get over this thing so that we can get back out, have some good food, have some good conversations, and move this thing that we are involved in called life along, That's what we're trying to do right here. That's what we all want. But if we don't do the right thing, we're going to see more shutting, stuff shut down. I don't care what they're saying. They're saying that no, we're not, but yeah, that's what they're talking about. They're even talking about, postponing school entry because the levels are so high here in this state. Something that, the governor was like, no, by no means. I mean, he threw a fit when he thought that they were going to hold off school. So that ought to tell you something. But I'm rambling now. I'm trying to keep it together. I'm trying to keep it organized and keep it interesting so that you guys can, follow this and do the right thing. I appreciate you guys listening to me. I appreciate, all of my subscribers and everybody who takes the time to come and listen to the content. I appreciate you all. Love you guys like family, especially, you Manosphere guys, man. You keep up the good work. I can't say how proud I am to see Black men trying to take up leadership and trying to change our situation in this country. I appreciate you all. Let's get this thing done.
I feel like a mother.